thought that what I would start out with today, I know many of you have been here throughout the change and creation of KIBA, but what I wanted to do was to take a little bit of time to review where we are. So this may be redundant, but it would also provide you a framework to go back and reference in the future. I'll have this presentation available for you in slide format, and Mike has kindly agreed to not only video it, but place it out on both of our websites for you to have at future dates. But KIBA was created by the General Assembly in July of 2012. We're governed by an 11-member board of directors. And let me just say that we have a very diverse and talented group of members on our board, and we're very pleased to have them serve. Many of them come to our board, though, without any previous history or understanding of public service. So one of the issues that we'll be working with on this year that we've already identified is the need to have some continuity on our board. Currently, our board members serve for 2-year terms, and they could all be replaced at the same time. You know how complex retirement and insurance matters are. If we are expecting to have a long-term, viable, educated, informed, and engaged board, we need to have greater continuity on that board. So we will be looking to many of you to help us determine what that future will look like. Our board is responsible for the state's insurance programs, the retirement programs, and the deferred compensation programs. I wanted to give you a slide here that showed you who each of our board members are, who appoints them, and which committee they serve on. Our board is segregated into 3 major committees. Most of our work is performed at the committee level. We have a retirement policy committee. That retirement policy committee takes up the actual valuations, the ORP investment providers, the deferred compensation plans, and those investment reports. And the FAC committee is the Finance Administration Audit and Compliance Committee. It takes care of basically all of the finance and administration, the financial statements for both health insurance and retirement. And then our last committee is our Health Policy Committee. This committee takes up the financial statements for the insurance plan, the actual valuations for the insurance plan, and the proposed plan of benefits, as well as looking at, from a forward-thinking standpoint, what changes do we need to make in how we ensure and deliver health benefits to protect our public servants. And to me, retirement security crosses both of those arenas. In order to have a secure retirement, you need to have both retirement income benefits and health insurance benefits. Our mission is to recommend, offer, and administer programs for retirement and insurance for our public employers, their employees, and our retirees. And if we do that at the end of the day, then I'll feel like we have done a good job. I'm going to go through some of these slides. It's more here for information for you to look back on. You may want to send some of it to your members. Some of this information, there are a comprehensive package of benefits that we sometimes forget how broad that is. But I've listed all the retirement plans here. All 5 of the defined benefit plans, the optional retirement program, and the deferred compensation plan. On the health insurance side, we have an array of the self-insured plans, which is the state medical plan, the dental plan, a basic long-term disability, and the adoption assistance program. And then we have a long list of insured programs that we outsource, Money Plus, Dental Plus. You can see the array of plans there. These are all public trust funds. That means they have to be used for the benefit of the members. They should not be obscured and used for any other purpose. They are entities in and of themselves. Each of the retirement systems trust funds are invested as a collective group trust. We look to the investment commission. They invest all of the retirement systems trust. The state health plan trust funds are not allowed at this point in time to invest in equities. So the OPEB trust funds are still invested solely at the state treasurer's office because they are not allowed to invest in equity, so they don't really fit the mold of the rest of the state retirement systems. At some point in time, I'm sure that the General Assembly will look to revisit that issue, because if we ever expect to fund those health insurance benefits for the future, they will need to be invested in other than a simple fixed income portfolio. We've laid out what the board's responsibilities are. As you know, the PIBA board, the Budget Control Board, soon to become the Revenue and Fiscal Affairs Authority, the Investment Commission, and the General Assembly all share some responsibility in setting policy, contribution rates, plan of benefits, etc. for the plans. So we tried to lay out on these slides for you what PIBA's responsibilities were. We act as co-trustees for the retirement systems, as trustees for the insurance plans. We make policy and strategic decisions, mainly related to maintaining fiscal soundness for the plans. We adopt funding policies. We oversee the investments of the optional retirement program vendors, and we adopt retirement plan investments for the deferred compensation plan. One thing that we know, and that is that it is imperative that we work with our co-fiduciaries for the benefit of the system, and that means that we focus collectively on solutions, that when issues arise, this is not a he said, she said, or point fingers. We need to share data completely, and we need to work collaboratively on solutions. I'm going to skip through much of this. You'll be able to look back at it later. This slide is really important because when we look at the unfunded liabilities of the system and the progress that we make towards funding the system, our relationship between PIBA and the Investment Commission is critical. The Investment Commission is solely responsible for investing the trust fund monies. We currently have approximately $30 billion in retirement trust fund monies. When the retirement reform was passed in 2012, this slide was created. And part of that discussion surrounded the fact that over the next 4 to 5 years until 2018, 2019, it was projected that our unfunded liability amortization period would remain at 30 years. And each year we would have to increase the contribution rates sufficient to keep it at 30 years. And only after we had progressed for about 4 or 5 years would we start to see that unfunded liability decline and our contribution rates stabilize. Because of the favorable performance that the Investment Commission has been able to achieve this past year, over 15%, and last year approximately 10%. That, combined with the statutory reforms that were made directed towards plan benefit provisions in the retirement system, those two things have worked collectively to reduce that unfunded liability earlier than anticipated. As a matter of fact, our actual evaluations have just been provided to us, and while our amortization period will still show a 30-year period, it's actually like 29 years and 6 months. So we're seeing that reduce several years earlier than we would have otherwise. And more importantly, while the employer contribution rate will go up in 2016 by 16 basis points, which was approved by the Budget Control Board last year, because we delay those contribution increases by 1 year, the actual valuations that are before the board this year will not require additional contribution increases for the following year. And that is a significant point for not only employees, but employers. To give you an idea of what the magnitude of that means, 1% contribution rate on the general fund side as they develop the budget, 1% in contribution rates equates to about $30 million Just to give you an idea of how frugal we are and how we manage our resources at PIVA, we participate in the CEM benchmarking study where we benchmark our services and our costs with our peers across the country. Our average cost per member is only $35, where our peers is $76, so it's significantly lower, less than half of what our peers is. Although our total service score is what concerns me. Our service score right now is 68 out of 100, and that's from a peer median of 76. A good bit of what goes into that service score is the amount of money we invest in technology, how up to date we are on the way and ability for us to provide services to our members. When we look at our peers across the country, we see many of them developing, one member statement. You get a member statement that shows you your defined benefit plan amount. It shows you your 401k plan amount. It shows you what your health insurance benefits are. You get everything on one statement, so it's much easier for you to make those types of decisions. We aren't there yet, but we hope to get there in the future, and I have a later slide that will talk about our operational assessment. Our deferred compensation plan is both a 401k and a 457 plan, and those are voluntary supplemental plans. We have about $3.6 billion in the deferred comp plans. When we look at the health insurance plan, we cover over 450,000 lives. We have over 180,000 active employees and 79,000 retirees on our health plan. The next few slides, I'm going to skip through those, but what I want to leave you with, the information that you'll see there, is when we develop what our copays and deductibles are for health insurance, and I know that as we begin the legislative session, this is going to be very important. Our members are always looking to make sure that they can afford their health care coverage, and we are a grandfathered plan. And that means that we are limited in the amount of flexibility we have in how we design our plan changes. We are limited in the amount of money that the General Assembly provides for the premium increases, and then we are limited to managing the plan with the copays and the deductibles that go with that. This past year, you'll probably recall that we developed a set of deductibles and copays based on the funding that was available. But because we are a grandfathered plan, we're only allowed to increase those deductibles and copays by a certain amount. So you'll see here where it says approved 2015, this was the slate of deductibles and copays that were approved and that many of you saw as they were discussed in the General Assembly last year. When we looked at medical CPI for the end of the year, it was less than we had expected that it would be, and that required that we carve back those deductibles and copays, which is actually a favorable action for our members because they will now have a smaller deductible and copay that they will have to pay out of their own pockets to provide. Sorry. That's right. But just to give you some idea of how our health insurance premiums stack up compared to our peers across the Southeast. There are 14 states in the Southeast region. Our employer contribution rate is about $470. The Southeast region is about $620, so we have about a 25% lower employer rate than our peers in the Southeast region. For the employee, the rate is about $160 per member, and across the Southeast it's $170, so about $10 less per employee than what our peers see across the country. In combination of those, our employer and employee rates combined are about 20% lower than what they are in the Southeast region. And when we look at our plan of benefits, our deductibles and copays are somewhere around the middle. The amount that we pay for out-of-pocket those amounts are somewhere in the middle when we compare those to the other states in the region. The slides will be out there for you to look at. Two last things I wanted to cover for you, and then I'm going to ask Ashley Brindle, who is in our office, to come up and give you some idea of what we have been working on with regard to GASB 68. But before we get to that, there are two items I want to cover with you. One is the fiduciary audit. Many of you are intimately aware of the fiduciary audit that was conducted for the Investment Commission. The Investment Commission then developed an implementation plan and are working diligently to implement those recommendations from the Funston report. Funston was also selected by the Office of Inspector General to conduct the fiduciary audit for PIBA. They began October 1st, and we are expecting that they will have a draft report issued very shortly, and their final report will be due to the General Assembly by the end of January. In our preliminary discussions with them, we believe that people will also have some work to do, and we are working to come up with an implementation strategy for the recommendations that we will see out of that report. I know some of you were interviewed by Funston as part of that fiduciary audit, and we look forward to the recommendations and our board's involvement in developing an implementation plan. When I think about the services that PIBA provides to our members, between PIBA and the Investment Commission, we really are the future for public servants in South Carolina. And the Investment Commission is critical in investing those funds so that we have that money to pay out to our members. We pay out right now approximately $3 billion per year in retirement benefits. We pay out another $2 billion in insurance claims and benefits. That's $5 billion that's pumped back into this state's economy each year. Think about that in comparison to the state's operating budget. That's a significant amount of money, and that is money pumped back into the state's economy each year because we are providing those benefits and services to our retirees and public servants. But as the Commission is charged with investing the money, PIBA is charged with providing the services to our members, from enrolling them when they first begin service with the state, to accruing their service credit throughout their years, to processing their insurance claims, to processing their retirement claims, issuing their retirement checks. It's important that we have a system that is developed and that has current technology. I mentioned to you earlier the service scores that we receive in compared to our peers. I think PIBA's doing a great job. But if we don't make significant investments in our infrastructure 5 years from now, I'm not sure that I will be able to stand up here and tell you that we will continue to be able to provide the level of service that we have historically. We have a significantly increasing number of retirees. We have significantly increasing cost and claims for health care, and we have not really invested in the past 5 to 10 years significantly in our infrastructure. So one of the things that we have begun is an operational assessment. We have an RFP out right now, and we are in the final stages of that request for proposal for the operational assessment. But just as other agencies are faced with a growing reliance on digital solutions, we have to take advantage of those new technologies to continue to meet the needs of our members. We have aging infrastructure. Many of our systems are written in languages that are no longer supported in the marketplace. We need to work further to coordinate between retirement and insurance so that we can provide cohesive services to our members. And all of that we expect to come out of the operational assessment. It will take us about a year to conduct that assessment. process reengineering is going to be a major component of that. And we would expect that what results out of that will be a roadmap for us to use for the next 3 to 5 years to implement projects that will basically redefine our system and provide us the continued ability to meet the needs and services that are required by our members. And I do realize that that was a very long and complicated presentation, but I wanted to make sure that you have a flavor for what PIBA is working on right now, because I would like to solicit your feedback. If there are services that you think that we need to improve on, services that we are currently failing to meet, if there are issues that you see, I'd like to solicit your input on an ongoing basis to help us better serve you. One of those issues, I mentioned that I'm going to have Ashley come up and make a presentation on GASB 68, and I don't know how many of you are familiar with what GASB 68 is. But my guess is over the next year, you're going to see a great deal about it in the press. And it's not going to look favorable in the press. And so it's important to me for you to have a venue to ask your questions and understand what the underlying issues are with GASB 68. We have an unfunded liability in the pension plan, and everybody in the state understands that and acknowledges that. The liability that is placed on the employers that participate in our plan has always been categorized as the contributions that they pay into the plan. That is their liability. Whatever the employer contribution rate is set, that's what they have to pay into the plan. GASB 68 requires all governmental entities to take that unfunded liability that's on the pension plan's balance sheet, and it has to be distributed and reported on each of the entity's financial statements. And that is going to look, in many cases, almost like those entities are insolvent. And that's going to generate a significant amount of negative press. GASB has said there is no change in the funding required for the plan. There is no change in the plan provisions at all. It is simply how it is being accounted for at the local government level. And that really may not matter to you, but when you read the issues in the paper, I just want you to be prepared. So I'm going to ask Ashley to come up and talk to you a little bit about that.
I would like to thank Peggy for inviting me to be here to speak to you all today about GASB. We have feverishly been trying to get the word out to our employers, and I think that while we have relatively good contacts, we tend to have aged contacts, and so sometimes when we try to communicate with our employers, we have a barrier to getting the right individual to speak to. So I'm thankful to be here to let you all know a little bit about these standards and to hopefully allow you to get back to your groups and let them know what we have available currently on our website and what we intend to do in the future to assist them in implementing these standards. GASB Statement 67 was related to financial reporting for pension plans that affected the pension plan reporting. We implemented that this year in our fiscal year, June 30, 2014 financial statements. I'll go over the changes on them in just a minute. 68, accounting and financial reporting for pensions, is the one that impacts the employers, and it is effective for fiscal periods beginning after June 15, 2014. The intent of the new standards, according to GASB, and many of you who may have been involved when PIBA, which was may have just become PIBA, was the retirement systems and became PIBA about the time that the initial statements were issued. There was a lot of work done initially, and so some of you may have been involved in that work. According to GASB, the standards are supposed to standardize the way that the reporting is developed and help with the decision usefulness of the reported information, improve transparency across different state and local governments, and improve the way the liabilities and expenses are reported. GASB believes that pension benefits are an overall part of an overall compensation package, and that certain pension costs if not funded by the plans, should be borne by the employer as part of a benefit package. The impact on the plans was a change, so the impact from 67 was a change in actuarial calculation of the total pension liability, which used to be referred to as the actuarial accrued liability, and the net pension liability, which was previously referred to as the unfunded liability. And there was a minor change in the presentation of the financial statements. It was really just a change on the title. The plan net position is now the fiduciary net position, and it expanded the note disclosures required as part of our financial statements, and the required supplementary information was greatly expanded as well. The impact on the participating employers truly is a disconnect between, and this is what Peggy mentioned, the accounting for and reporting of the pension liabilities and the funding of the pension liabilities. There is now the requirement, which Peggy mentioned, to record a proportionate share of the liability by the employer on the face of their statement of net position, and the proportionate share of the pension expense. It'll now be a proportionate share calculation of a set pension expense that is actuarially determined instead of just their salary or covered payroll times the required contribution rate. It also requires a large increase in note disclosures and required supplementary on the part of employers. This is just a really quick overview. The total pension liability is reduced by the net position of the plan to come up with the net pension liability, and so the big difference is that total pension liability is now being reduced by the market value of plan assets versus a smoothed actuarial value of assets. This is just an overview of how we calculate the proportionate share. PIBA made the determination that it would be done based on contributions. So this is just a really quick little overview of how we calculated it, and the determination of once that liability is figured, the net pension liability, how we then apply that proportion. So PIBA has done a number of things from the beginning. It was mentioned that we were at the forefront trying to impact change, and ultimately what we're trying to do now is deal with what was implemented, and we have made the changes on our financial statements, and now we turn our focus to our employers and assisting them in implementing. We have created a special accounting and financial reporting resource center on our website. If you go to our main website, there's a GASB resource center icon in the top right-hand corner, and that site is providing up-to-date information to our employers with where PIBA is and what we intend to do. We have posted on that site an unaudited schedule that contains the information that employers will need to book the unfunded, the net pension liability, the pension expense, and the various pieces of that liability, the deferred inflows and outflows as well. And then we have also surveyed employers to obtain information about their audit firm, their financial statements, to ensure we have the appropriate contact person, so that when we are providing training and additional information for them to use in implementing these standards, that we would be communicating with the appropriate person. We have presented at a couple of conferences and conducted some in-house seminars for our staff so that when they receive questions, they can give a basic overview. But in general, I am there to assist employers, and that is currently my dedicated role. We also established an email address for employers to send inquiries. It's pensiongasb@piba.sc.gov. It's at the end of this presentation. We monitor it on a daily basis, so if someone does not have my contact information, and in general, preferably they would send inquiries to that that address. We also have engaged our external audit firm to audit the underlying data used to develop these schedules. That's only recently been completed, and not the audit itself, but the contract with them, and we do intend to have a separate audit opinion issued on those schedules on which the employer auditors can rely when they're going through and doing the audit of those employers. Again, this is our resource center site and the email address for questions for employers. This is an extremely high overview. If anyone has any questions, I'll be happy to go over it in